The Republicans' Obamacare repeal bill is currently wending its way through the Senate. It could be released any day now, so how did we get here?
Well, it's kind of complicated. Whether it's by design or just lucky timing, Senate Republicans have been working away on their new healthcare bill, pretty much under the radar, as attention is focused on those investigations into Russia and the Trump campaign, and at a time when the current healthcare system is starting to look pretty shaky. When Barack Obama signed the Patient Protection and Affordable Care Act into law back in March of 2010, hopes were high, certainly on the Democrat side, and Vice President Joe Biden memorably summed up that historic moment, although at the time he didn't know anyone but the president could hear him.
President of the United States of America, Barack Obama.
The promise of what was already being called Obamacare was to provide healthcare for more than 20 million Americans who didn't have it because they couldn't afford it or had been denied coverage because of a pre-existing condition. But President Obama made one promise time and time again that he just couldn't keep.
If you like your doctor, you will be able to keep your doctor.
If you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. Nobody is talking about taking that away from you.
Because Obamacare set minimum standards, some people lost their cheap plans which didn't cover much and may not have even paid out if they'd ever claimed, but at least they were cheap. Still, prodded along by an individual mandate that penalised you for not getting a plan, millions of Americans got health insurance for the first time. Kids could stay on their parents' plan until they were 27, and people with chronic illnesses could get insured. But then last year, just weeks out from the election, the cost of premiums started to jump significantly.
In one state, Arizona, premiums are more than doubling to about $400 a month.
And suddenly, Donald Trump had a powerful campaign issue.
On my first day, I'm going to ask Congress to immediately send me a bill to repeal and replace Obamacare. Repealing and replacing, immediately repealing and replacing. We will be able to immediately repeal and replace Obamacare.
Turns out it wasn't that easy, and after the Republican-dominated House dramatically failed at the first attempt to pass their own healthcare bill in late March, they succeeded at the second whack in early May, by the barest of margins, sending the American Health Care Act to the Senate, which is now working on its own bill, and, well, it's complicated.
Now, I have to tell you, it's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
The Congressional Budget Office said the latest Republican plan would see 23 million more Americans uninsured in a decade. In the meantime, there's growing evidence that Obamacare isn't going so well either. The cost of individual Obamacare policies have gone up by an average of over 100% in just 4 years. Insurers are now pulling out of states, leaving many wondering if they'll be able to buy insurance at any price.
I've been saying for the last year and a half that the best thing we can do, politically speaking, is let Obamacare explode. It is exploding right now.
Democrats say Republicans have been sabotaging Obamacare from day one. Republicans say it was always bound to fail. The question now is, what happens if Republicans let Obamacare fail and can't replace it with anything close to what President Trump promised as a candidate last year?
This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
Universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
Well, that's great news, Donald. The problem is no one knows exactly what your current healthcare bill is, because Senate Leader Mitch McConnell has been tinkering with it in secret, not letting anyone see it, presumably to minimise media scrutiny. Democrat Ron Wyden tweeted out this comparison with Obamacare's 2009 Senate passage. 36 days of hearings in 2009 to 0 today. 18 days of bipartisan amendments to 0. 270 hours of debate to 20 scheduled hours of debate today. And that's no accident. When a Senate Republican aide was asked when they'd publicly release the draft healthcare bill, they replied, "We aren't stupid." Let's face it, it's good tactics. If you don't let the media know what's in the bill, then no one can scaremonger, no one can pressure you, no one can turn up at a town hall and make you look bad. Just look at the number of mentions of the phrase healthcare bill on cable TV news recently. You can see in the week before the first House healthcare bill, the bill got a fair few mentions and it failed. Then going into the second House vote, there were a lot fewer mentions and it just passed. Now, Mitch McConnell, who is a master tactician, is keeping everything as secret as possible, and you can see the TV mentions flatlining. Democrats should find that very ominous. And that's not the only way Republicans are maximising their chances of repealing Obamacare. I've told you before about cost-sharing reductions. They're the extra subsidies the government pays to make Obamacare plans cheaper by up to $5,500 for poor people. Come over here. If the government doesn't pay those extra subsidies, then health insurance will become more expensive for the poor and they'll drop their private health insurance altogether, possibly destroying the Obamacare market. Now, so far, this administration has been paying those subsidies, but they're keeping everyone guessing about what they'll do in the future. So when insurers set their 2018 premium prices, they have to assume the worst. And here it is. A 30% increase in premiums, a 50% increase in premiums, a 30% increase, and a 20% increase. Note, Blue Cross and Blue Shield openly admit there at the bottom their increases would only be 9% if those subsidies were being paid. Obamacare prices were supposed to stabilise this year. Those numbers you just saw are what failure looks like, and it's leading to companies like Anthem pulling out of the Obamacare market in some states altogether. Now, Anthem blame a lack of certainty of funding for cost-sharing reduction subsidies. That's what we we're just talking about. But who knows if it's true? All we know for sure is that insurers are dropping out. These are the counties with only one Obamacare insurer left. And these are the counties with zero left. That's right, 47 counties currently have no Obamacare options for 2018 whatsoever. That's 38,000 people who cannot purchase insurance even if they want to. So is it sabotage? Or is that just an excuse for a failing system? And this is all about to be repealed anyway. John, should we get some experts in?
I think we should do exactly that. And we have two experts with two very different political starting points, at least. Sam Berger was a senior policy advisor at the Obama White House Domestic Policy Council, specialising in healthcare. And Ilia Somin is Professor of Law at George Mason University. He's also an adjunct scholar at the Libertarian Cato Institute. First to you, Sam Berger. Welcome to Planet America.
No, thank you so much for having me. I really appreciate it.
So we keep hearing from Republicans, from the president on down, that Obamacare is in a death spiral. It's imploding. Is that the case?
Well, it's not. I mean, certainly going into this year, it was the case that the marketplace was actually on quite strong footing. As you may be aware, last year we had some pretty significant premium increases, and that was part of insurers figuring out how to price in a new market in which they had to basically cover everybody who wanted to have coverage. So people were anticipating an increase in the single digits or low double digits this year. Unfortunately, what we've seen from the administration is an effort to sabotage the law. This includes threatening to withhold billions of dollars from insurers, as well as threatening to make the marketplace sicker by reducing enforcement of the individual mandate, as well as reducing some of the marketing and outreach efforts that help bring young, healthy people into the market.
But of course, and there are some cases where there seems to be some kind of structural failure going on as well. Insurers pulling out of most counties in states like Iowa, giving people no competition or in some cases no ability to access coverage. So it's not working perfectly.
I mean, I think certainly everyone agrees that the Affordable Care Act could be improved. In fact, the Obama administration was working hard or trying to work hard to do so. But there was a resistance on the other side. Republicans aren't interested in seeing this law work. They're interested in attacking it, whether it be for political purposes or for some sort of ideological opposition to providing health care to people.
So what would be done tomorrow if there was the political will? If a Democrat had won last November, what would be being done now that is not being done to fix the ACA?
There's a couple things you could do. One, you could increase the subsidies. You know, it turns out that the Affordable Care Act was coming in far under budget in terms of what it was costing, and so there's some funding there that could be used to try and increase the subsidy structure. You could also create what we call a public option. So in a circumstance like you talked about in Iowa, in which insurers were concerned about the market, there'd be a public fallback for people to be able to sign up for coverage.
Now, that public option, of course, was something that Democrats have talked about for a long time. This is something that has been kind of the holy grail, but Obamacare didn't end up going there. Was that, in retrospect, a mistake? Was it just not possible at the time?
You know, at the time, we were making very significant changes to the healthcare system, changes that have been extremely successful. You know, 20 million people covered, the cost of care going down. I mean, this is a law that is, while certainly not perfect, was working quite well. But at the time that it was being passed, you know, for Democrats, you know, they had to get, in our system, they had to get the 60 votes and then use later the votes for reconciliation. And so, you know, you had to work with everybody in the party, and there were some people that weren't as comfortable with that at that time. So I think this was a matter of the political reality, but we got a very good law out of it. And quite frankly, if people across the aisle, if Republicans had been willing to work with Democrats to try and improve it, you know, I think you'd see it working even better today.
Sam, what did you think the other day when the President himself described the House bill as mean?
So I don't usually agree with the President. I will say in this case, he was on the right track, but I don't think mean really captures exactly what it will do. I mean, 23 million Americans losing coverage. We're talking about taking $1 trillion away from folks to help them afford coverage in order to give hundreds of billions of dollars in tax cuts to the wealthy, to insurance companies, to drug manufacturers. It's immoral. So I think it's further than mean, but obviously it would be great if Republicans recognize just how devastating the effects of their proposal would be.
So, Sam, where are we up to in terms of the Republican Senate bill? Because it seems as though, you know, they've essentially said that the House bill is dead on arrival, so we're going back to square one. But do we know what they're working towards and how likely it is to pass by that July 4 deadline they've set themselves?
You know, the process over here is sort of incredible. You have a bill being written in secret. No one knows what it does. Many Republicans don't know what it does. There are no hearings, no chance for doctors, for healthcare experts, for patients, for advocates to weigh in, to give their thoughts, to help people understand exactly what it's doing. And I think that's sort of representative of the quality of the bill we can expect to see from this process. If you have a good bill, you put it out there so people know what it is. And if you're hiding it, you know, there's a reason that you're hiding it.
Do you fear that given the politics of this and given the stakes for Republicans who've been talking about repealing and replacing Obamacare since before the day it passed, that this is going to get forced through? The numbers will be there and it will be close enough to reconcile with the House bill, and it'll be there come what may? Well,
I mean, I think we're at a crucial moment. You've seen a huge outpouring of concern from the American people. Thousands upon thousands, hundreds of thousands of people calling in, calling their their member in the House of Representatives, calling their senator, making it clear just what this bill will do. I still hope that with this sort of concerted effort on behalf of people in this country, advocates for this law, you know, doctors, patients, those sorts of folks, that people will sort of see the light and realize that snatching health care away from millions of people in order to give tax breaks to those who don't need it is just a bad thing to do. It's bad policy, and it's just bad.
Now let's go to Ilia Somin. Ilia, welcome to you.
Thank you.
So what is your assessment? Democrats say that Obamacare has been sabotaged by Republicans, not just through uncertainty, but through withholding subsidies to insurers. They're basically putting it into a death spiral. Do you agree with that assessment?
I think that's very premature, but I also think that Obamacare had very serious problems long before Donald Trump came along. So even though he may well be making things worse in some respects, although I'm not a fan of his at all, it would be a mistake, I think, to say that the only problems with Obamacare are ones that have been caused by the current administration.
So we heard after the first House Republican bill, the one that ultimately didn't go to a vote, it was dismissed by some as being Obamacare light, not going far enough. The one that passed has now been described by the President as mean, and we don't know what the Senate's going to come up with. So where are we up to in all this?
Your guess may be as good as mine. The bill that passed the House was widely criticized on both the right and the left, and it seems like it's practically dead on arrival in the Senate. The Republican senators are drafting a health care bill of their own, or at least they say they are, but right now, even many Republican senators don't seem to know what might be in that bill and whether it might come up for a vote anytime soon. So I think there is significant disagreement among the Republicans themselves about what should be in this bill, and they're having significant problems resolving them. And of course, even if the Republican senators agree on a new bill, it would have to go back to the House, and the original bill had only a 4-vote margin. So it remains to be seen whether anything that the Senate passes, if the Senate does pass something, whether it can then get through the House also.
There is this fear that that something is being put together in secret that's going to be foisted upon the American people almost without warning.
I'm not a big fan of the process by which this is being done. On the other hand, if it's going to be foisted on the American people at all, it can only be through a vote of the Senate and of the House. So sooner or later, if they want to push this thing through at all, they will have to bring it out into the open.
How confident are you that Republicans are looking at what needs to be done to, if not fix Obamacare, to rebadge it, but fix what is wrong with healthcare in America today?
I'm not all that confident. I think Republican politicians, like most politicians, probably look after their political self-interest first. I think there are also just deep divisions within the Republican Party about what should be done. They all agree, or most of them agree, that they don't like Obamacare, but they have deep differences about how it can be replaced and with what. And whether they can overcome those differences remains to be seen. And what also remains to be seen is if at the end of the day, what they come up with will actually be better than what I at least think is a seriously flawed status quo. But unfortunately, both Trump and the other Republicans have shown that they're entirely capable of coming up with things that are even worse than the status quo. So we'll have to see what happens.
Talk us through, Ilia, the political considerations for Republicans right now, because on the one hand, it does seem as though a large amount of their credibility is locked into getting something that repeals and replaces Obamacare. They've been talking about it long enough, and yet the alternative is so wildly unpopular it could hardly be in their political self-interest, could it?
It's hard to say. On the one hand, they've made a very strong commitment to passing some kind of repeal and replacement bill for Obamacare. It'll be hard for them to retreat from that entirely. On the other hand, enacting a new system that will both work and be popular and will get enough Republican votes to pass, that's turning out to be extremely hard. And I think there might be ways to get around it, but so far the Republicans have proven remarkably inept at actually figuring out how to do it.
Well, we certainly appreciate your insights. Thank you so much for taking the time.
Thank you for having me.